The mission of the Fordham University Ravazzin Center on Aging is really to empower social workers and other healthcare professionals to make a difference in the lives of older adults, family members, and all generations. And what we do is we partner with many different agencies on different projects, and also working with students, faculty members, and community members to effect change.
It creates synergy that makes a very unique opportunity for us to develop knowledge and develop practices and further our understanding of older adults and their families.
As we know, the older adult population is the fastest growing segment of society. Age 85 and older are growing faster than any other part of society. So we felt that this was very important to look at the Ravazzin Center to help older people prepare as they age to talk with their physicians, their nurses, their social workers, to gather the information about how they could improve and keep quality of life in their health.
The CDA Burden Network collaboration with the Fordham Ravazzin Center on Aging is a wonderful opportunity for us to help educate our seniors about how best to communicate with their healthcare provider. We know that this is a very important aspect of overall health and wellness. I can say that the feedback we've received from our seniors has been overwhelmingly positive. They're always looking for ways to improve their overall health, but more importantly, it can help to empower them to be better advocates in taking care of their own health.
So another program we work on is palliative care, and we have the Palliative Care Fellowship at the Graduate School of Social Service, which is one of very few in the entire country. The Palliative Care Fellowship has a number of components. The heart of the fellowship is the internship that the students do, and they do this with experienced palliative social workers. They're working on inpatient palliative care teams in hospice, in oncology, long-term care, pediatrics, and then they take 2 courses, palliative social work and grief, loss, and bereavement. They meet with a career mentor throughout their fellowship year and in the year after to help them really strategize their career and to get that career going. There are a lot of patients out there who need specialty palliative services, and there's not enough trained social workers in the workforce to meet those needs. So this program is intended to contribute to that workforce.
What is important to look at is understanding outcomes. And in doing this, outcomes have to be measurable. And what we try to do in our research within the communities is helping agencies and organizations how to look at the change that they're desiring and how to see if it's really affecting change.
In my role as program director for Westchester County Department of Social Services, a federal grant called Westchester Building Futures, I spearhead along with an amazing team of researchers, direct service professionals, and community-based advocates, a grant that focuses on serving young people in foster care ages 14 to 21. Really, our purpose in the grant is to really think about ways in which we can improve outcomes for young people in care, really through the lens of youth, voice and choice, and equally importantly, family engagement. So that is, we're really working with all members of the family, from the grandparents to the younger siblings, and working with Dr. Jana Heyman, who's our principal investigator, and her leadership at the Ravazzin Center has really been a great partnership with the Westchester County Department of Social Services.
We train our coaches to help our many thousands of caregivers here in Westchester County to better care for their loved ones. The coaches are trained by healthcare professionals, so we have social workers, we have nurses, we have geriatric care managers that train our coaches.
The Ravazzin Center is really working on diverse caregiving initiatives. My own research is looking at long-distance caregiving. You know, we find that the average live 500 miles away. We have some caregivers in our sample that are international. And so we're trying to understand what the challenges are for them and what kind of services can support them in the role. And we work with the Ravazzin Center in terms of dissemination.
The Ravazzin Center is a great training ground for our students to learn about research, learn about understanding connecting research to social work and social work practice and policy, and they get them ready. That integrated approach is a real unique aspect of the Ravazzin Center.
I did 2 internships. So my first year I was able to work with high school students and gain more of an administrative experience. Whereas my second year, I kind of went to a different level and did more clinical work, working with older adults, and which also gave me a nice introduction to the Ravazzin Center, which is where I'm able to kind of put all that into use.
One area in particular that resonates with me is their focus on minority populations. And so one of the areas that they've started to explore a bit is looking at LGBT health and trying to focus in on the needs of LGBT seniors and how do you promote resiliency and positive health outcomes among the elderly population.
And what's critical is that we don't just do the research, but we replicate the research and then we see what works in practice and how not only do we take that practice, but what we learn from it, the lessons learned, and how we can affect that change, not only in the practice and the research, but in future policies and future policy decisions on a larger basis in communities, statewide, nationally, as well as internationally.